Morning, Marita.
Morning.
How are you going today?
Good, thank you.
Had a pretty busy morning already, I think.
Yes.
Crazy. Well, thanks for coming over today. We're just going to do a quick 20-minute session on setting up a clinical supervision relationship. So, I guess in this session we'll explore some useful topics that you might want to discuss with your supervisee when setting up a clinical supervision relationship. But have you had any experience with clinical supervision in the past?
A little bit, really, but it was sort of not pre-planned really, just whatever happened during work.
A little bit ad hoc.
Ad hoc, yes.
Yeah, I see. Yeah, that's pretty normal.
Yes, nothing formal.
So this might be helpful for you then, sort of trying to set up more of a formal relationship. Great.
Good.
And can you remember the things that you might have discussed when setting up the relationship previously? Or
Look, I think clinical supervision was more like I didn't know somebody and would approach somebody to help me solve the situation or the issue. So there was no official setting up or anything.
yeah, so you kind of like hallway conversation stuff. with
Yes,
your colleagues?
or just because in my other job I work in a very big room. So you can just call on people, or in nursing, because you just can approach a more senior person and ask. Sometimes, if you're lucky.
Yes, yeah.
Sometimes you can't.
Yeah, I suppose if you've got the confidence to go up and approach someone more senior, or someone could be, I guess, working away and not have the confidence to go and talk to
And it's more a
someone.
time issue. It's probably not so much the confidence, more the time
Yeah,
issue as well.
not having the time. Yes.
And yes, and you have to feel comfortable doing it.
Yeah.
And hopefully the person you're approaching is nice to you.
So today we'll just be spending about 20 minutes on this session, and I haven't planned any breaks or anything. We'll just get it over and done with.
Good. Sounds good.
So I'll be discussing a bit about things that could be useful to discuss in an initial meeting, and then I'll demonstrate that. We'll be watching a video, so you don't have to listen to my voice all the time.
Okay.
Someone different. Then we'll do a bit of a practice, and then we'll just do some evaluation at the end.
Okay, good.
So basically our learning outcome will be at the end of this session that you'll be able to coordinate an initial clinical supervision session, including maybe using a contract of some kind, setting some goals and expectations, being confidential with the record keeping and some troubleshooting.
Good.
And if you needed to use the toilet, that's just down the hallway. And if we need to evacuate, we just go straight out the door. So I just thought we could start off with brainstorming some things that might be useful to discuss in the initial meeting. Can you think of anything?
Maybe how often you would meet.
Yeah, definitely.
Also, how long the sessions might be.
Yeah. There's some pen and paper here if you feel like writing things down, because they're really good ideas.
And what else? And maybe setting objectives for the meetings, like from one meeting to another, maybe.
Yeah. I guess so. You have
Goal
some
setting.
framework. Goal
Yes,
setting,
yes,
yeah.
smart sort of situation.
Yes, definitely.
That's about it. Maybe where you want to meet.
Yeah, that's right.
Yes.
Sort of just the initial sort of record keeping and admin side of things is important, I think. Some things we normally miss.
Yes.
I have a list here. I guess sometimes it's useful to discuss your strengths and weaknesses as well, so that you and your supervisor get to know each other on that level as well. That can be helpful. I guess sometimes in supervision you feel like you're constantly talking about things that you need to work on, like your weaknesses, I guess, but it's still important to talk about your strengths in clinical practice too.
That's a good point.
Yeah.
And I must say, actually, I probably wouldn't call it supervision. It's more like mentoring.
Mentoring, yeah.
So that's what I'm in at the moment. I guess.
Yeah.
So that's
Having a bit
It's
of
probably
an
the same thing,
opportunity.
isn't it? Yes.
Yeah.
And
I
with the
guess-
contract as well. We signed the contract.
Yeah, they're very similar, aren't they?
Yes.
Maybe your learning styles as well, kind of like that the questionnaire that I got you to fill out the other day online, that could be something that you could do with your supervisor so that you're both aware of what learning styles that you have.
Yes.
So that you can incorporate that into the clinical supervision sessions. Yeah, I think that questionnaire was quite helpful, I suppose, even to get you thinking about your own learning styles.
It was, and I found it very useful. I mean, I've been studying quite a lot, so I was quite aware of it, but it sort of confirmed a lot of things.
Yes, yes. Great. Well, we've got a copy of a contract that could come in handy.
Okay.
Have you seen something like that before?
Yes, I have.
Yeah.
Yes, I have.
I think something like that's pretty helpful to have it just all written down in black and white. So
yes, I actually need to do the same for my credentialing, like for my mentoring. So yes, but it's not as detailed, really. No, it's probably not as detailed. Like if
it's probably one of the more detailed ones.
Prepare for each meeting, yeah. But it's very similar.
I guess you could still modify that document and make it into what exactly you want it to be, but it's pretty detailed, so it's got most of the stuff in there. You could just cut and paste what you like.
Yeah.
So we might just watch this video now and then discuss what worked well and what didn't work well.
Okay, good. So is that is accessible for everybody?
I could give you a copy of the disc.
No, it's a disc, okay. I'm just asking.
Your first clinical supervision session with a new supervisee is probably the most important one because it can set the tone for all future sessions. Here, we'll look at how to structure your first session.
Yeah, I'm not sure if it's on YouTube yet, but
Many
I
supervisees
thought
will
about
be new to
asking
clinical
about that.
supervision. In fact, you might be pretty new to it yourself, so setting expectations is a crucial first step in establishing an effective clinical supervisory relationship. You might begin by explaining that clinical supervision aims to support the development of clinicians and ensure the delivery of high-quality patient care. Okay, so today's meeting is about how to make clinical supervision as useful as possible for you. Oh, okay.